Dr. Atul Gawande, welcome to the Daily Social Distancing Show.
Great to be here.
You are coming to us from Fenway Park, one of the many stadiums and arenas that are going to be used as vaccination sites around the country. How is the rollout looking? You know, America's been in an interesting place where it seemed like everything was going well, and then all of a sudden there weren't enough vaccines, and then there were too many in some places. What does it look like on the ground right now?
Well, I'm part of a consortium that's been running vaccine operations to scale up Gillette Stadium, Fenway Park, Reggie Lewis Track and Field here in Roxbury, and those have escalated. You know, we had to start at a few hundred a day. We're past 5,000 across all of these sites per day, and that will just keep on scaling upward. And so I think that our problem of distribution will gradually get better and better. The two problems that remain, number one, you point to supply. How much can vaccine get pumped out? It's a big deal that the Johnson & Johnson vaccine was submitted for consideration by the FDA just last Friday, and that will potentially bring more supply. The other big concern is equity. We are not getting to the people of color and the rural settings, which have had some of the worst rates of spread, and bringing those people in has got to be a high priority now.
Let's talk a little bit about your article in the New Yorker. You've written for the New Yorker for many years, and now more than ever, people are reading your writing through a different lens. Your most recent article is entitled, "Don't Tell Me What to Do," and it focuses on a really fiery town hall meeting in a small town in North Dakota. Why did you think it was so important to focus on a fight happening in a small town in North Dakota, and what do you think that tells us about the larger story about America, its vaccine rollout, and social distancing rules and masks, etc.?
Last November in North Dakota, that was the state with the largest rate of infections, the largest rate of hospitalizations, and deaths were climbing. And Minot was the hottest of the hotspots in that state. And so what I want to understand is, how does a community in the midst of all of this react? And you know, the state had resisted having any kind of a mask mandate. There continued to be battles over the basics. And so this city council had a member, her name was Carrie Evans, who said, you know what, I'm just sick of it. I'm going to propose a mask mandate and force it to vote. And what unfolded was this debate. It was reflected a town-wide debate over whether the government could tell me what to do when we aren't willing to do it. And would that work? They fought it out. It was closely voted, but they did adopt the mask mandate. And that was only the beginning. People ignored the mask mandate after it was adopted. It didn't have any penalties associated. But then hospital leaders started coming out and saying, our hospital is completely overrun. And we'll see in place after place, there's a story like this, where we're late to coming to realizing what needs to be done. But in the face of what becomes just a terrifying level of viral transmission, Carrie Evans said it was like steam. You go to the store and you felt like it was this steam. You know there are infected people when walking around the store, and that was the world they were in.
You're a doctor, and so that means you are in the world of convincing people that medicine can and will help them. You're also in the world of listening to people's concerns about why they're afraid to participate or not participate in taking of medicine or not. There's a more interesting dynamic conversation happening right now in and around America's schools. Many parents want their kids to go to school. Many teachers are saying, we can't go back into the schools unless we're vaccinated. The CDC has come out and said, teachers don't need to be vaccinated to be at school with these kids. Where do people stand? Because it feels like there's so much contradictory information. Are the kids a threat to the teachers? Are they not? Can the teachers survive without getting a vaccination? What should we be listening to, and what is the voice of reason in the room?
Well, you know, in many ways, this is what I was trying to unpack even in Minot, North Dakota, because I spent a lot of time with the people on the other side of the argument, the people who said, and what you hear, whether it's teachers saying they don't want to go back to school because of fear of the virus, or others who say, I don't want to fear the virus, get rid of the masks. What you have is a tremendous amount of pain. I mean, the level of pain that you see in the country the people I was talking to who said they don't want to wear the mask are the people who are feeling like their jobs are disappearing and they're seeing it happen. They are seeing their kids not being able to go to school. They've seen them lose a whole year of, a real robust education.
Right.
And so I understand where folks are coming from. At the same time, this is the battle. We have to argue it out. And ultimately, the science is on the side of saying, yes, we can return to the schools. Let's bring testing in, and that can help provide reassurance. Yes, we can defeat this virus, but you have to wear the masks, and that means curtailing things like your favorite bar or being out here at Fenway Park. But we are making our way through it. It is tremendously hard to keep your foot on the pedal for what are going to be months to come. We are going to slip. We're going to have this battle and debate, and it's just going to continue. And this is the nature of our democratic fight over them.
Yeah, it's going to be a fight. It looks like we're still in the middle of it, and hopefully we're not just in the eye of the storm, but we're emerging from it. Dr. Gawande, thank you so much for taking the time, and good luck with your efforts out there at Fenway.
Thank you.